delighted to have you all here. To ensure a smooth session, we kindly ask everyone to keep your microphone muted during the presentation. This session will begin with a talk from Professor Jianliang Shen, followed by the discussion part hosted by the Professor Amir Fahmy. It's now my pleasure to hand over to our host, Dr. Lei Zhang. He is from Zhejiang University. Dr. Zhang, the floor is yours.
Okay. Can you hear me?
Yes.
Yes.
Okay. Okay. So, thank you, Jenny's introduction. So, it's my honor to join this meeting, and I'm very glad to interview communication with other friends. So now, please like me to introduce our journal first. So we very appreciate the journal give us this platform for us the communication to with the other the friends from the international the researchers. So the journal, the BME Horizon, is an international the open access journals. It's owned by the Science Exploration Press. And this journal is dedicated to the advanced research and innovations in the field of biomedical engineering, and it is the interdisciplinary applications. So this journal provides a platform for many research fields from the biomedical materials and tissue engineering, and biomedical imaging, and biomedical device, and also bioinformations. So this is the very wonderful the journal. So we are welcome the people to submit your work in these journals. So next is to let me introduce the editorial board. So we have Professor Bu Yongma is the editor-in-chief. So the other executive editor and editorial the board members from the famous the global university and the institute from the China and the other countries. So so next we will introduce our the speakers. Our from Professor Jianliang Shen. So, so we are very privileged and honored to invite Jianliang to give us this wonderful presentation. So I will introduce Jianliang at first. He's now is a professor working in the eye hospital affiliated in Medical University. Jianliang has received his PhD degree from the Jianliang Shen University in 2014 and completed his post trainings at the Houston Methodist Hospital Research Institute in 2017. And then he started integrated research work as a full professor at Wenzhou Medical University. His research now, the current research interest is focused on the hybrid materials and for the advanced cancer immunotherapy and the tissue engineering. So he published more than 200 papers. So it's very productive the researchers. His paper published in some very high level journals, including the Nature Biotechnology and Advanced Materials and angles. So, and 42 papers of his publication were selected as the ESI, the highly cited papers. And his each index accessed 63. So now we have welcomed warmly Professor Jianliang will give us the wonderful the presentation. And after the presentation, we invited Professor Amin Fahmy serve as the discussion guest. Professor Amir has been a professor since 2017 at the Royal University of Applied Science. He started his research career at the end of the 1990s. In 2005, the Dr. Fahmy was appointed as a senior research fellow at the university. He established his group within the Nottingham's innovative the manufacturing research center. His current research is focused on the fabrication of nanostructured materials through the self-assembly of polymer materials and some of the inorganic nanoparticles. So he published more than 100 papers in the international journals, and also writing some of the textbook title about polymer, the chemistry and the structures, and several of the book, the chapters. So welcome the famous professor to join us. So next we will give the floor to Professor Shen, give us the wonderful presentation. Okay, so now is your time, Jianliang.
Okay, thank you so much. I will show my PowerPoint here. Okay. Could you hear my voice and see my PowerPoint?
Yes.
Okay.
Okay.
Hello, everyone. Firstly, it's my honor to be an editorial member of the journal BME Horizon. And I also want to thank you, Dr. Wang, for to organize this webinar. And I also want to thank you, Dr. Fami and Dr. Zhang, these two hosts. And the topic of my presentation today is hybrid materials advanced biomedicine. And my presentation consists of four main parts. Firstly, let me briefly introduce the research interest of our group. Actually, we mainly make some hybrid biomaterials, combining the inorganic material and organic material through the covalent bond and the non-covalent bond to obtain the hybrid system with biomedical functions. Briefly, we take advantage of each other's strengths or make up for each other's weakness, then use this hybrid system for some biomedical application, such as tumor immunotherapy and tissue engineering. Today I will focus on these two parts and briefly introduce the tissue engineering, including antibacterial, anti-inflammation, and promote the wound healing with the high quality repair. And the second part, I will talk about the tumor immunotherapy, like the photodynamic therapy and the radiotherapy trigger the immunoresistance, how to use this hybrid system to address these issues. Okay, firstly, I will talk about the first part. Our first part focuses on the antibacterial, anti-inflammation, and promote the wound healing. Actually, everybody will suffer bacterial infections in our daily life. Most of the bacteria are viral infections during the incubation period or in the invasion period. In clinical, the clinicians will use the antibiotics to fight bacteria. But the continued use of these antibiotics can lead to drug resistance and sometimes of the emergency of soup bugs. The antibiotics are also selective only for like the positive or negative bacteria. About 10 million people 10 million deaths due to the antibiotic resistance in 2050. And most of the cases happened in Asia and Africa. So we need to find some new technologies or new tools to find these bacteria issues. Besides the problem, the previous slide, I talk about the antibiotic resistance, and sometimes the bacteria enzyme will degrade the antibiotics. Also, the location in the infection would healing. The bacteria phages will eat some antibiotics. And when the quick growth of the bacteria, when they generated the biofilm, The generated biofilm will reduce the use of the antibiotics because the antibiotics cannot easily penetrate the biofilm. So with the quickly development of the nanotechnology, nanomaterials can solve some problems in the use of antibiotics, such as the improving the bioavailability and reduce side effects. What we mainly focus is to develop some broad spectral and antibiotic independent hybrid system. We can use the property from the inorganic material such as light, electric, ceramic, and so on. And most of the times we can modify with the organic materials such as the PVP, PG, and hydrogel to improve the disadvantage of the inorganic material, such as the stability, stability, and sometimes the organic material, such as the silk fiber and other hydrogel, we can promote the cell proliferation or promote the tissue regeneration. Okay, I will give some examples for the antibacterial. First example, we use these materials, such as here we design the inorganic materials. They are antibiotic independent. The first example is the oxygen defect molybdenum nanomaterials. These materials with a function like the sonodynamic after modification, previously I said like the PVP or PG to improve the inorganic stability, disability. And this material also have the light, like the near-infrared light, enhance the sonodynamic to achieve efficient antibacterial therapies. We also developed some hemodynamic, like we recently the guys developed some nanoenzyme. For example, here we use the Maxine materials. They have a good like the nanoenzyme catalytic activities to generation more like the reactive oxygen space to fight the bacteria. Both of these cases, actually, both of these cases, they can respond to the light and to kill the bacteria, also inhibit the biofilms. Recently, I will give we develop a new system. Here is the one detailed examples. Actually, here we use layered double hydroxide oxide LDH material for sonodynamic. Actually, what we do here is to defect this hybrid system. We optimize the pH with the different pH and the inch time.
Recording stopped.
Okay. And to get the final hybrid system. This hybrid system is very interesting after optimized to get the sonar sensitized. After responding to the sonar
Recording in progress.
then this system could generation about 4 times more reactive oxygen space than the original materials. So after that, we evaluate this hybrid system in vivo. No matter in the bacteria infection abscess or in the eye disease eye model, it has a very good antibacterial effect. This is some examples when we design some antibacterial like the antibiotics independent hybrid system. It's very important because the bacteria will be suffered for everyone in our daily life. The second part I will talk about the anti-inflammation. If we divide the 3 stage for the infection, chronic bacterial infection was into 3 stages. Like first stage is antibacterial, and the second is anti-inflammation. Why I said that the second stage of anti-inflammatory
Recording stopped.
very important. If stay in this inflammation keep a long stage, what will be happen? It's impossible to enter the third stage of the cell proliferation or tissue repair. And usually in this chronic or diabetic world, in this microenvironment, lots of the reactive oxygen space and sometimes dysregulation of the metal proteins. In clinical, the most common chronic disease is diabetes, about 11% of the human beings right now. So to address the inflammation problem of the diabetes world, we construct a hybrid system with the SOD enzyme activity briefly introduced here. We use the zinc ions and the GA, like the glyceride acid through self-sensible to into the hydrogel. This immunoregulate hydrogel has a good SOD enzyme, and also they successfully reduce the reactive oxygen space through the omics analysis and Western blot. This system could regulate the NF-kappa B pathway to promote the macrophage to M2. The macrophage M2 is the anti-inflammation type. And the in vivo result, we observe that on day 3 or day 7, like the marker of the M2 CD206 and the ARG1, they are overexpressed. That's meaning lots of the anti-inflammatory macrophage in the on day 3 or day 7. That's meaning they will promote the wound healing. This is the case only the diabetic or chronic disease model. If the this is another case, we will think about that. If only the diabetic words, they have already lots of overexpression of the reactive oxygen space. If this diabetic was affected with the bacteria, what will be happen? We believe that the bacteria usually infection can secrete more pro-inflammatory factors. So here we prepared a hybrid system. We use the CHX. This is a clinical used drug for antibacterial. Then we self-sensible with the EGCG. This is the component of the green tea for anti-inflammatory properties. So the in vivo results, when we self-sensible this CHX and EGCG, one is for the clinical use for antibacterial, the other one is the major parts from the green tea for anti-inflammation. Then we use some hydrogel like here we use the JAMA gel to evaluate this hybrid system systematically in the in vivo study. The in vivo results indicate this hybrid system could successfully antibacterial, and the immunofluorescence staining experiment shows that this hybrid system could reduce the pro-inflammatory factors such as the TNF-alpha, and also increase the anti-inflammation marker like the CD206. And this system also promotes the blood vessel growth. So based on these parts, for talk about some work, we regulate the macrophage to from M1 to M2 to promote the water healing. So recently we received the invitation from the Chemical Society Review to summarize the hybrid system, like the hybrid system hydrogel for chronic inflammation. In this review, we also figure out like the macrophage, what we have done, and other immunocells like the neutrophil and the monocyte. We believe this immunocells is very important in the diabetic or chronic inflammation microenvironment, we need to regulate the type. If we successfully regulate these immune cells, we believe it could be promote the wound healing. So after that, antibacterial and anti-inflammation, the final goal is the third stage is how to accelerate the wound healing and the high quality repair. Based on the properties of the infected chronic wound. Sorry, here we just first example is focus on the chronic, the diabetic wound. Based on the microenvironment, the first is that the high glucose and overexpress reactive oxygen space. So here we design a hybrid system. We use the gold and platinum and the modification with the melanin. And we utilize the gold and the platinum serve as a glucose oxidase enzyme. Actually, it could successfully reduce the glucose concentrations and also promote also generation some oxygen. The oxygen is good for the macrophage transfer to M2, and the organic part like the melanin, they will reduce or escape the reactive oxygen space by the phenolic hydroxyl. If this hybrid system under the near-infrared light in radiation, more oxygen will be generation and escape the IOS more effective. And the in vivo results indicate this hybrid system could reduce the size of the wound by inhibiting pro-inflammation factor, for example, the TNF-alpha, and also promote the blood vessel growth to accelerate the wound healing. This is the case to reduce the amount of glucose and generation oxygen mainly based on the internal microenvironment response. Recently, we developed a hybrid system to reprogram the metabolic microenvironment through the exogenous photosynthesis and endogenous glucose metabolism. And this hybrid system, we use the water hyacinth. This is actually is not good for our daily life. This is a environmental protein. Then to extract the chloroplast, and also use the metformin as an endogenous glucose metabolism. And self-sensible with the solid allogenate through the microfield. Although lots of reports talk about the oxygen, talk about the producing oxygen, most of the cases they are use the living agar. The living agar may cause safety issues such as the immunorejection and other side effects. After obtaining this hybrid system, we have done a systematic evaluation in the mini pig model. It could successfully reduce the size of the wounds. Much more safety and this hybrid system firstly could successfully reduce the size of the wound, and also with lots of other advantages such as the more safety. What I talk about, like for the major organs like the heart, liver, spleen, lung, kidney, most of the in this tissue. And finally, I will get a short summary from this part. Actually, we design based on the bacteria infected chronic wound. We design some hybrid system for the inorganic and organic micro or nano system to serve as the biotech's independent method to fight the bacteria. And the second part, how to regulate the inflammation to promote the third stage to obtain the high quality tissue repair. And the second part, I will talk about our hybrid system enhance or address like the photodynamic radioimmunotherapy trigger the immunoresistance. And here we'll talk about some background. However, with the quick development of the nanotechnology or other technology, we have already have lots of advanced diagnosis technology, but the cancer still is one big issue. Still is the second leading cause of death, less than the cardiovascular disease. Actually, so with the quick development like the nanomaterials or the immunotherapy like the PD-1, PD-L1, and the CAR-T, we can use these advantages to address some like the some reported work for the photodynamic therapy, photocell therapy, and the radiotherapy. Here is some successful examples why we want to use the nanotechnology or in the biomedicine. The first successful example is that the Doxil, the first liposome formulation approved by the FDA, and 10 years later, the first protein-based, like the ABX approved by the FDA. Here they use the albumin and the paclitaxel, I believe, then self-sensible the nanoparticle to reduce the side effects and enhance the therapy. Also, some successful like the nanoparticle, polymeric nanoparticle for the siRNA therapy. So, okay, I will introduce our work for the immunoresistance, how to address the immunoresistance. As well know that the chemotherapy, radiotherapy, these are clinical used, and such as the photodynamic and sonodynamic therapy. Both of these therapy, they will trigger one problem is that promote the TGF beta PD-L1 overexpression. This will result in the immunosuspension microenvironment. That's meaning the immunoresistance. Of course, for the clinicians, they will use the antibody because the antibody with a very strong affinity and prolong the survival time of the patient. But in our side, we will think about in the patient side, because the patients will need to receive the more antibody treatment. That means they need to pay lots of the money. And the second reason is that if the patient received lots of the antibody treatment, maybe cause the high systemic immune risk. And sometimes like for example, the PD-L1 antibody is not work for everyone because the PD-L1 antibody just reduce the overexpress of the tumor cell on the surface, and the PD-L1 may be overexpressed in the cytoplasma, mitochondria, and other location. We designed the first example is that to address the photodynamic therapies, immunotherapy, immunoresistance. As well know that photodynamic is very interesting or very effective for the tumor suppression. Here is one typical molecular IR68. This is a photosensitized after modification after chemical reaction with the rhodamine, and then self-sensible with the albumin. This is the final hybrid system. Here, this hybrid system could target the mitochondria and decrease the dosage, also tumor-selective PD-L1 depression. And as well know that most of the photosensitized need lots of the oxygen. If without the oxygen, the photodynamics will not be good. And the lodindamine here we used will reduce the consumption of the inside the oxygen, reduce the consumption of the oxygen inside. So next, firstly, we want to talk about this hybrid system, the accumulation, how many of nanoparticles accumulated in the tumors. After we evaluate that, after 48 hours, our hybrid system nanoparticles could stay in the tumor, but the IgG free only 24 hours. So that's meaning our nanoparticle could be stayed in the tumor tissue. And the lodindamine could be regulated the PD-L1. So in this case, we evaluate in the CT26 tumor growth tumor model. And this hybrid system could reduce the size of the tumor much better than the antibody. If we combination the photodynamic therapy here, the IR68 with the photodynamic ability, because the lodindamine could be reduced the oxygen, so the HIF-1 alpha like the it will give much more benefit for this photodynamic therapy. So after combination, this hybrid system serve as a self-oxygen and self-immunoregulation nanosystem. After this case, we find that the photodynamic therapy not only trigger overexpression of the PD-L1, also the TGF-beta. So we design a hybrid system. Also, we use another typical photosensitized MHI, and we use the other drug like the tamoxifen. This drug can downregulation the TGF-beta and the PD-L1. The first case I have already talked about the PD-L1 downregulation that will enhance like the photodynamic therapy and much better than the antibody. And this small molecule also with the function to downregulation the TGF-beta. And the TGF-beta is very important in the tumor metastasis. If overexpression the TGF-beta, the tumor will go everywhere in the body. So after we get this hybrid system, we use the albumin protein to get this hybrid system. And the previous slide, I talked about this system could downregulation PD-L1. So of course, this one could inhibit the tumor growth quickly, successfully. And the tamoxifen also could downregulation the TGF-beta. I said the TGF-beta is related to the tumor metastasis. So here we evaluate in the 41. This is the breast cancer tumor, triple-negative breast cancer tumor model. This tumor model will quickly grows and metastasis to the lung. And after treatment with our hybrid system, compared with the free antibody, similar efficacy in this hybrid system. And first two examples, we use some organic photosensitized and self-sensible with the protein like the albumin or lipid. And also we design some metal photosensitized. Here we use the iridium photosensitized and modification in the bacteria to get the hybrid system to enhance the photodynamic immunotherapy of the tumors. This work is very interesting. We use the bacteria. This bacteria, they are like stay in the half-shell environment. That's meaning they can go to the tumor tissues because they want this is the ability like the intrinsic self-propelled molecule. Briefly, they can go to the tumor tissue by themselves and invoke the innate immunotherapy and adaptive immunotherapy. And here is the some in vivo study. Firstly, we evaluate this hybrid system after modification with the bacteria. Bacteria, they can stay in the tumor tissue about 5 days. 5 days, but only the free drug, like the only stay in the tumor about 1 day. They will be disappear in the tumor or disappear in the tumor. So then we evaluate this hybrid system could reduce the size of the tumor very successfully. And because of the macrophage and the NK cells, this is related to the innate immune response and also like the dendritic cell, CD4 positive cell, CD8 positive T cell. This that's meaning they will invoke like the adaptive immune response and promote the killing T cell go inside the tumor tissue to kill the tumor cells. And this part, I get a short summary. We focus on the photodynamic therapy, trigger the immunoresistance. And we design some hybrid system to address like the PD-L1, TGF-beta, and this hybrid system could make more nanoparticle stay in the tumor to enhance the photodynamic therapy. Actually, the last part I will talk about radioimmunotherapy. Because radiotherapy is very common in our daily life for the cancer patient. About 60% of the cancer patients will receive in radiotherapy. And here is the mechanism. I will don't talk about much more the mechanism, and I will focus on the immunoresistance. Actually, as well know that after radiotherapy, lots of the patient will lose their hair and side effects, and so on. Actually, if we focus on the immunosuppression effects of the radiotherapy, the first one is that increase the PD-L1, increase the TGF-beta. These two protein I have been talked about previous slides. And radiotherapy is also sensitive or dependent on the oxygen. If we want to get a better radiotherapy for the patient, they need a lot of oxygen in the tumor tissues. Actually, they will reduce when radiotherapy going for the patients, they will reduce the oxygen. And there are other side effects like the leading to the lung fibrosis. Lung fibrosis is a high risk of death. As well know that several years ago in the coronavirus period, most of the guys died because of the lung fibrosis. So here, the first example is we designed the hybrid system. We use the albumin and magnesium oxidized, and also use the TPP metformin, and after step by step to get the hybrid system. The most important of this hybrid system, the metformin, the TPP metformin, they will go to the mitochondria to reduce the oxygen consumption, and also the magnesium oxide generation the oxygen to enhance the radiotherapy. Here we can say that the confocal microscopy to indicate that if only treatment with the radiotherapy, the radiotherapy, here we use the gamma H2X, this is a DNA damage marker. When treatment compared to this group, when treatment with our group, lots of gamma H2X will be happened here. That's meaning the generated oxygen promote the radiotherapy. And the second, the TPP metformin, the metformin could downregulation the PD-L1 successfully, and also can downregulation the TGF-beta. That's meaning this hybrid system, we use metformin to downregulation the PD-L1, TGF-beta. That's meaning they can inhibit the tumor, local tumor, and the metastasis tumor. The mechanism oxidize not only played the oxygen generation, they also could, the mechanism ions could active the C-gas-STING pathway to reserve the radioimmunotherapy. Why the mechanism, the mechanism ion can active the C-gas-STING pathway? Because the mechanism ion can promote the dendritic cell activation, promote the dendritic cells mature to kill or promote the T cell and other functions. So after that, we evaluate this hybrid system in vivo. Actually, they successfully downregulate the PD-L1, TGF-beta, and the HIF-1 alpha. Okay, and promote like the killing T cell, like the CD3 positive, 4 positive, CD8 positive, to go inside, more population go inside the tumor. Of course, they can inhibit the tumor growth of the local tumor as well as its lung metastasis because of downregulation the TGF-beta. So this case, this case, I talk about the radioimmunotherapy trigger the immunoresistant like the PD-L1 and the TGF-beta and like the metastasis potential. After use our hybrid system, we can solve some issue of radioimmunotherapy result in the immunoresistance. And the final example I will talk about that the lung fibrosis, because this is very important. After radiotherapy, most of the about half percent patients, about 50% will leading to the impaired function of the lung. This is the high risk of causing death. So here we design the hybrid system. We use the I68. This is a photodynamic photosensitizer. After that, we modification with the tamoxifen. This hybrid system could reduce the TGF-beta, PD-L1. This is very similar with our previous work. So after that, we evaluate this nanomaterial. This nanomaterial about 22 nanometers, and anyway, this hybrid system could stay in the local tumor, also could stay in the lung tissue. Here is the lung metastasis tumor model. Anyway, this hybrid system could stay in the local and can also go to the lung, so they can inhibit the local tumor growth and the lung metastasis tumor model. Also depress the formation and growth of distal tumors. And finally, what we care is that how about this hybrid system could reduce the radiotherapy triggers the fibrosis. Here we can say this is the vehicle. If this is a health one, if treatment with the radiotherapy, we can see lots of this part, lots of lots of the fibrosis. After treatment with the hybrid system, actually they will successful reduce the fibrosis. So get a summary here. We designed some hybrid system for the photodynamic immunotherapy or radioimmunotherapy. They can trigger the immunoresistance like the PD-L1, TGF-beta, and some others. And also for the lung metastasis or lung fibrosis and other work. We hope some new work will be publication soon, and I will get another presentation for the next time here. So the conclusion that we developed some hybrid system to improve the wound healing, like antibacterial, anti-inflammation, and promote the wound with high quality repair, and enhance the tumor immunotherapy also. I need to thank many thanks to our group members and the funding from the government, university, institute, and also with the big support from our collaborators. If without this support, we can do nothing here. Okay, that's all. Thanks so much.